In this third European CAR-T-cell meeting, we will be presenting our safety and efficacy outcomes of ARI-01 cell therapy in relapsed refractory ALL patients, but we'll be analyzing a particular type of patients. We will be talking about patients with isolated extramedullary disease. This is a particular group of patients that people think that might behave differently than the general ALL population. Because people might think that as isolated extramedullary disease might be a specific type of disease that might have a different or worse prognosis due to the capacity to evade T-cell immunovigilance. We wanted to assess if this was true or not. We treated 15 patients with isolated extramedullary disease, and one of the first things that caught our attention was that it was a very, very heavily pretreated group of patients with a median of 5 prior treatment lines. They had been exposed to immunotherapy in 46% prior inotuzumab and also 46% prior inotuzumab, and up to 86% prior allogeneic stem cell transplant. So there was a very heavily pretreated group of patients. And one of the first things that caught our attention as for safety is that these patients had a particularly good safety profile. There was incidence of all-grade CRS of 40%, but there was a 0% incidence of severe CRS. We only used only one patient needed tocilizumab due to grade 2 CRS. And on the other hand, there was no case of any grade ICANS. So this particular type of patients might have different or maybe a better safety profile than the general ALL population. The other thing that caught our attention is also there were concerns about the efficacy that might be different than the general ALL population. So with this work, the sample size is just too short, and maybe the follow-up also is not very, very long. But as far we seem to see a trend of duration of response and the quality of response that maybe it's even better than patients with bone marrow relapse.